You now have the floor.
Welcome to all. Thanks a lot. I'm really looking forward to hearing all the speakers today. And I'm going to tackle the first subject, which is cystic fibrosis in female fertility. And the overview or the outline for the program is I'm going to talk a little bit about fertility in women with cystic fibrosis, and then talk about pregnancy in CF and some of the areas that are important there, the overall statistics, how does pregnancy affect one's health, and what concerns we need to have, if any, about CF medications. I'll talk briefly about delivery and breastfeeding, and also mention when would be a sort of medical time when pregnancy is not advised. Now, the good news is that over the last several decades, there's been improving survival in people with cystic fibrosis, and better survival means more adults with CF, and more adults with CF means more people wanting to start a family. So this has become an increasing issue over time. One of the questions that people ask initially is fertility in women with CF reduced? I think a lot of people are aware that in men with CF, there is reduced fertility. But the problem with fertility in women is that it's very difficult to actually assess it. With men, you can sort of do a semen analysis and see if there's sperm in the semen. But to assess fertility in women is a little bit more difficult because you have to try and get pregnant and not be able to get pregnant in order to be able to tell if someone's fertile. Now, in the past, the problem was that healthcare providers gave people with CF, women with CF, the advice that they shouldn't try to get pregnant or have children, and so that it was very difficult to assess fertility if people weren't in fact trying to have a pregnancy. If you look back in the literature, the first reported pregnancy in CF was in 1960. And you can see that both from the American U.S. CF patient registry and from the Canadian patient data registry, there's increasing numbers of pregnancies. So in 1986, in that year, there were 50 pregnancies in women with CF reported in the States. And by 2009, there were 226 pregnancies reported. As would be expected with the difference in the overall population, about 1/10 as many pregnancies as seen in the States would be seen in Canada. And in 2010, 21 pregnancies occurred in women with CF across Canada. Now, what are the factors that might influence fertility in women with CF? Well, one of the factors we've known about for a long time, and that is that the CF protein, CFTR, actually is present in the cervix. And that means that the secretions in the cervix are thicker than normal. Ordinarily, what happens is that during a woman's menstrual cycle, at the time of ovulation, the secretions become very watery and thin, and that allows the sperm to penetrate through the secretions to fertilize the egg. But in women with CF, this isn't happening. There's no thinning at the time of ovulation, so this thick mucus acts as a barrier to the sperm. There are some other reasons why fertility in women with CF may be reduced. One of them is, again, related to the CF chloride channel. And the defect in CFTR actually alters the bicarbonate concentration in the uterus. And having an abnormal bicarbonate concentration can affect sperm function. So that the sperm, even if it gets into the uterus, may not work as well. And finally, there's some suggestion that there may be reduced ovarian reserve in women with CF. And that means that there may not be, the problem may be at the level of the eggs. And where they have some data to support this is that if you look at the mouse model of CF, you find that female mice with CF have reduced ovarian function. We've noticed by screening women in our clinic, and Anna Sang, our nurse practitioner, did this study, that we found that women with CF seem to have earlier menopause, and other researchers have found that women with CF have a delay in when the age at which their first menstrual cycle starts. And we also know that women with CF have more periods that are not associated with ovulation. So there's some suggestion that the problem is not just a barrier at the cervix or an abnormal environment in the uterus, but there may be something wrong with the ovary as well. In fact, Cystic Fibrosis Canada funded a study at our center looking at ovarian function in CF, and 20 women with CF were compared to 20 control women. And we looked at all sorts of measures of fertility of the ovaries, and one of them was this AMH, or anti-Müllerian hormone level, and that is a good marker of ability to conceive. And what we found in this study is that women with CF had lower levels of AMH than the control women, and that suggested that lower ovarian reserve happened in CF, and that might relate to lower fertility. Obviously, more research is needed to be done in this area.